Are you a supplement brand owner or own label distributor who's curious about FDA's requirements for your brand? One of the biggest reasons that supplement marketers or brand owners get shut down by FDA is because they didn't have good written procedures that met their requirements under the Code of Federal Regulations. That's 21 CFR 111, also known as Good Manufacturing Practices for Dietary Supplements. And even if you don't actually make the product, you're still required to do certain things, like have standard operating procedures, SOPs, and records that show that you followed the SOPs. So briefly, here's the top 9 FDA required SOP for supplement brand owners or own label distributors that you need to have and follow. So the first SOP that you need is one that outlines the responsibilities of your quality department. So you need to have somebody qualified to make sure that whatever your manufacturer is making for you is meeting the FDA requirements. And that may require a supply agreement or a quality agreement with your manufacturer. It probably requires somebody to review your label and review your specifications and your ingredients. And so it's CFR 111.103, subpart F. You must establish and follow written procedures for the responsibilities of the quality control department. The second SOP that is really important is one for training. So part of the CFR 111.8, you must establish and follow written procedures for fulfilling the requirements of your personnel and your operations. So that means you need to have qualified employees or qualified consultants that are part of the SOP. So the third big SOP that you really need is one for label development and review. You have no idea how many labels I see that have mistakes, that are poorly formatted, have typos, have overblown claims. And it's part of the requirements, CFR 111.410, subpart L. You must examine packaging and labeling for each batch to make sure that the labels conform to the master record. And you might be able to let your manufacturer do that, but do you really trust them? And so this is a really important SOP to have. The fourth most important SOP that you really need to have is one for product receiving, storage, and distribution. And even if you outsource that to a warehouse, you need to have requirements for the warehouse. For example, is your product stable under certain temperature requirements? Well, you need to outline the temperatures and the humidity needed for the warehouse to store your product correctly. So the fifth SOP that's really important is one for product returns. You need to know what you're going to do with products that come back. Do you reuse them? Do you inspect them? Is it possible that you could send out a product that was previously returned? So all these things need to be outlined in this SOP. The sixth biggest SOP that you need is one for complaints. So it's CFR 111.560, subpart O. A qualified person must review all product complaints to determine whether the product complaint involves a possible failure of quality, including issues which might lead to illness or injury. And within this requirement are two other very important SOPs. You need an SOP for product recalls. Just in the rare event that your product needs to be recalled, whether due to undeclared allergens or some other manufacturing issue that you never even knew about, you still need to have this SOP so that you can report correctly and meet FDA requirements. The other SOP that you need within the complaints structure is one for adverse event reporting. So if somebody claims they've gotten sick from your product, you need to have a questionnaire and you need to log all of these reports. And if you get a report of a serious adverse event that requires medical care or hospitalization, then you need to have a procedure for reporting that to FDA. And lastly, the SOP that you really need to meet FDA's requirements CFR 111.605, Subpart P, record keeping. You must keep written records for 1 year past shelf life date in most cases. And so if you're not keeping these records and updating your SOPs, then you're not meeting FDA's requirements. And so if you need work on your SOPs or need more information, check out my website, www.n as in nature, p as in product, scientific.com. And reach out if you have any questions about your requirements as per FDA.